Hello everyone. In today's video, I'm going to talk about my experience in COVID-19. But before I proceed, I would like to thank to all my families, my aunts, my uncles, my friends in Facebook and the LDS members of the church who gave me some prayers for my fast recovery. I would like to thank to all of them. Okay, let us begin. The transmission, how I get the COVID-19. I believe that is coming from my granddaughter, 17 months old, who got tested positive somewhere around September 1 to September 14. My 26-year-old son was exposed to her. So on September 7, we tested my younger son, and the result was inconclusive. On September 11, we tested it again. He was tested negative, but my son has symptoms. He doesn't have a fever, but he has a cough, a little cough, just very little cough. So I believe I lowered my guard at the time, and I got it from my younger son, not from my granddaughter, but from my younger son. But he was negative. So I believe I got infected on September 18. Knowing that my son was negative, I let her massage me because I was so tired. So I believe I got the COVID-19 infections from my younger son, not from my granddaughter. The father of my granddaughter, which is my older son, was not infected at all, even if she slept for 2 days with her daughter. My wife was not also infected at all. So that's how I believe I got it from my son. Now my son, I believe he got probably infected somewhere around September 7 or September 11. But then, until now, October 14, he still tested positive. We tested we tested my younger son on October 10 or October 7. He tested positive. We tested it again after 3 days, October 10. He still tested positive. So I think my son has the longest viral incubation. In the first few months of the virus in Wuhan, China, there are statistics that the virus can linger up to 1 to 24 days. So I think it's a big mistake for the CDC to cut down to 14 days because I think there are some individuals that can still incubate the virus for a month. It's like my son, he's still tested positive right now. Or the other explanation is that the PCR is so sensitive that when we tested on October 7 and October 10, showing a positive result, it could be a viral fragments, a remnants of the virus that could still be detected by the PCR, which is very sensitive test. So he might not be infectious at all, but he still have the viral fragments. So that's the other explanation. Now my symptoms. I have an on and off slight fever for 9 days. On the 9th day, when I try to cough, which I don't have a cough, but when I try to force to cough, my lungs, my chest begins to hurt. And most of the time, I sharded. I cannot control. I don't know if it is a fart or there's an actual poops, but it's hard to control. So that's one of the symptoms. And also my voice changes. Have you noticed my voice right now is different from before? I have an Elvis-like voice before. I'm just kidding, but right now it's totally different. My oxygen saturation level at that time was low. It dropped to 60, so I was scared to develop an acute respiratory distress syndrome. My CRP level at the time was trending higher. Sorry, it's a misspelled. These are the results: 1.5, 3, 4, 6, and 15. So my CRP level, my inflammation was rising. And the other scary part is my D-dimer. The D-dimer was increasing from 0.75 to 3.5 to 4. 3.5 to 4. So luckily it didn't continue to go up. They gave me some anticoagulants. I was scared of thrombosis or cardiac heart attack at that time. My CBC was normal, remains normal at all for the whole time. Now the treatment. On the first day of the hospital, they only treat my diabetes. They only give me insulin. They manage my insulin and give me azithromycin. And I asked the doctor if I can have something to prevent viral replications because I don't want to wait to develop a cytokine storm before you try to treat me something for the virus. So the doctor agrees and he offered me a remdesivir. And yes, I agreed to receive the remdesivir. I'm not sure if I spell it right. I think I spell it wrong. So they gave me remdesivir and also steroids, including the azithromycin. And I also asked the GP doctor that if they can give me vitamin D, thiamine, zinc, vitamin C. And I explained to the doctor, I know I'm not trying to do their job, but they're not giving me, so I have to be proactive. So I asked him for vitamin D, which he knows that could boost my immune system, and the thiamine. Also, I explained to him that it will reduce the production of interleukin 17, which eventually in the downstream will reduce the production of interleukin 6 and thermonecrotic factor alpha. And I also asked them for zinc and vitamin C. So fortunately, the GP agrees. And I've noticed that the zinc has a positive charges. It's hard for the zinc to get inside the cell. So it needs an ionophore, like hydroxychloroquine. I didn't ask for hydroxychloroquine. So I just take bromelain. I take quercetin with bromelain, 400 milligrams. It is a flavonoid. It is a flavonoid that coming from the pineapple and broccoli. So I don't think it will harm. He didn't know that I take it. And the third day, same treatment as the second day, and I became better. Fourth day, they discharged me early in the morning. And when I get home, I go back to my regular coronavirus prevention. So I continue to take 400 milligrams of bromelain plus 60 milligrams of zinc, 3 capsules of turmeric, 5,000 international unit of vitamin D3, thiamine, vitamin C, and I also take vitamin methyl B12, magnesium L-threonate. Now, this over-the-counter medicine or over-the-counter vitamins, my wife is taking this one every day. My oldest son is also taking this every day. And I believe that for 9 days that my wife was exposed to me every day. She massaged me every day because I was so tired, I have a muscle fatigue. She was not infected at all for 7 days. She's been taking this medicine. This vitamins. So I believe now that turmeric has a powerful antiviral effect. Besides than this one, my wife also take a powdered garlic, which is also an antiviral. Been taking an she's been taking every day. So I believe that that is the reason why she was not infected at all of this. So I just like to share this one so that people can also maybe protect themselves. So thank you very much, and please share this to your friends so that they can be benefited, with to protect themselves. So click subscribe if you like it, and also the notification bell. Now, some of my videos are here. These are the links to all my videos. Uh, you can click here to go to some of my videos. Thank you very much.